Intraoperative radiation therapy. It's new, innovative, and it's an alternative to whole breast radiation following a lumpectomy.
Right now, the therapy is going through a clinical trial in the U.S. And as Shelley Botat tells us in Health Watch, Aurora BayCare Medical Center is one of only 25 centers in the country chosen to take part.
Typically, breast cancer patients going through a lumpectomy and radiation have to endure weeks of treatment. But now a new therapy going through national trials can deliver a similar dose of radiation in just one session.
Georgia Benny is always faithful with her annual mammogram.
A year ago, I had one that didn't turn out so well, turned out to be cancer.
Georgia needed a lumpectomy, followed by radiation to prevent the cancer from coming back.
Our local hospital is not equipped for cancer treatment.
So she drove 2 hours to meet with Dr. William Owens, director of the Comprehensive Breast Care Center at Aurora BayCare Medical Center. Georgia had two choices for radiation: traditional radiation.
That involves numerous treatments, upwards of 6 weeks of treatments, 30 treatments 5 days a week, where the woman has to come in and have a treatment. And the X-ray energy can cause damage to the skin.
Or because the hospital is part of a national study, Georgia could choose intraoperative radiation therapy.
When we remove the lump, there's a space where the lump was removed, and we insert a device into that space that gives the radiation directly there. And so it irradiates about an inch around the edges of where the lump was removed. And then the device is removed, and that's all the radiation the patient needs.
Georgia chose IORT, which has several advantages, including one treatment instead of 30.
It provides benefit of convenience for the patient. There is no skin damage because the internal device is used.
I didn't have the stress of knowing I was going to have to drive 60 miles to get radiation therapy the traditional way for 6 weeks.
An earlier worldwide study of thousands of women who received IORT found
the chances of the cancer growing back were really not significantly different between the two.
Aurora BayCare is the only hospital in Wisconsin to take part in the national trial.
And the hope is that we'll be able to identify those patients that are good candidates, and it would become just a standard form of treatment.
Georgia just had her one-year checkup and has no sign of cancer.
I would recommend it to anybody who's a candidate.
Not everyone is a candidate for IORT. Patients chosen for the study have to be at least 50 years old, have an early-stage small-sized tumor, and cannot have any lymph node disease. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Shelley Botat, Local 5 News.
Thank you, Shelley. A new and improved way for women to have mammograms. Tomorrow in Health Watch, new technology means sharper images and less radiation.
Well, now